Swallow once right now and pay attention to what you feel at the back of your throat. A thickness. A coating that clearing your throat doesn't actually clear. If that's familiar, you've probably been told it's just allergies, or just getting older, or just something you have to live with. I want to show you why that answer is usually incomplete and walk through what the actual research says is going on, because in most cases there's a specific identifiable reason, not just age. Here's the physiology almost nobody explains clearly. Your airways are lined with millions of microscopic hair-like structures called cilia, and their entire job is to sweep mucus up and out before it can pool. In a study comparing younger and older adults, researchers measured how long it actually took mucus to clear the nose. In younger adults, it took around 11 minutes. In older adults, it took nearly 17 minutes. That's not a small difference. It means mucus that would have cleared quickly at 40 can sit and accumulate for a meaningfully longer stretch after 60. That single fact is the foundation for almost everything else in this video, because it means anything that increases mucus production is going to feel more noticeable and last longer than it did years ago. With that foundation, let's go through the specific research-backed reasons this happens, because there are really 4 common ones, and knowing which applies to you changes what actually helps. Quick note before we continue. I'm someone who spends hours going through actual published, peer-reviewed research, so you don't have to. That's what this channel is built on. Tell me in the comments, is your throat worse first thing in the morning? Or does it bother you all day long? Your answer actually narrows down which of these 4 causes is most likely. The first and probably the most under-recognized cause is something called laryngopharyngeal reflux, often called silent reflux. Most people know classic heartburn, that burning feeling after a heavy meal. But there's a version of reflux that doesn't feel like heartburn at all. Research published in a review on this exact condition in adults over 65 found that stomach contents can travel up past the esophagus into the throat itself. And when that happens, it doesn't just burn. It directly irritates the throat lining and disrupts the genes responsible for normal, healthy mucus production. The result is thicker, stickier mucus and a throat that won't settle. Multiple clinical studies list excessive throat mucus as one of the single most commonly reported symptoms in patients formerly diagnosed with this condition, alongside throat clearing and a sensation of something stuck in the throat. And here's the detail that trips people up. A large proportion of people with this condition report no heartburn at all. If your throat is noticeably worse first thing in the morning, or worse after lying down, that pattern is worth paying attention to. The second cause is one people often mistake for allergies year-round. Chronic postnasal drainage from the sinuses, not the dramatic version with a fully blocked nose and facial pain, but a quieter, ongoing, low-grade drainage running down the back of the throat. This is extremely common and often gets treated with over-the-counter antihistamines that dry things out temporarily but don't address the underlying sinus inflammation causing the extra mucus in the first place. The third cause genuinely surprises people because it hides inside something meant to help them. A specific class of blood pressure medication. ACE inhibitors, a very common and effective category of blood pressure drugs, are well documented to cause upper airway irritation as a class-wide effect. Research reviewing this literature found the incidence of related cough and throat irritation ranges between roughly 5 and 35% of people taking these medications, and separate research has specifically noted that elderly patients are more susceptible to this effect than younger patients. The mechanism involves a compound called bradykinin, which these medications cause to accumulate in the body, and in sensitive individuals, that accumulation irritates the throat and upper airway. The detail that causes this to be missed constantly is timing. This side effect can take weeks or even months to appear after starting the medication. So people rarely connect a throat symptom that started 6 months ago with a prescription that started 8 months ago. If you take a blood pressure medication and you're not sure what class it's in, your pharmacist can tell you in under a minute, and if it is an ACE inhibitor, there are other medication categories that treat blood pressure just as effectively without this specific side effect. That's a conversation worth having with your prescribing doctor, not something to change on your own. Comment the word checking if this is prompting you to actually look at your medication list today. The fourth piece ties directly back to where we started. The natural, age-related slowdown of that mucus clearing system itself, because that clearance system runs slower after 60. The same amount of mucus that your body handled easily at 40 now sits around longer and feels more noticeable. This isn't a disease. It's physiology, but it does mean that supporting that clearance system through hydration genuinely matters more than it used to. Adequate fluid intake keeps mucus thin, enough to move efficiently, instead of sitting thick and sticky, and it's a factor that's easy to underestimate, precisely because it seems too simple to matter. So here's what the research actually supports doing about it. If your throat is consistently worse in the morning or after lying down, avoid eating within 3 hours of bedtime and talk to your doctor about whether silent reflux could be a factor, since it often responds well to identification and targeted treatment. If you suspect ongoing sinus drainage rather than reflux, daily saline nasal rinsing has real clinical research behind it as a safe, low-cost way to physically clear inflammatory mucus and support your natural clearance system though it does require consistent daily use to see a real difference, not occasional use. Review your medication list with your doctor or pharmacist, specifically asking whether you're on an ACE inhibitor, especially if your throat symptoms started sometime after you began a blood pressure medication. And simply stay ahead of your hydration throughout the day rather than waiting to feel thirsty, since thirst becomes a less reliable signal as we age. One more important note: persistent throat mucus is usually benign and explained by exactly what we covered today. But please see your doctor promptly if you notice mucus with blood in it, worsening difficulty swallowing, unexplained weight loss, or a lump in your neck, since those symptoms fall outside everything we discussed and deserve direct medical attention. I'm not a doctor. I'm someone who reads the actual published research, so you don't have to. And this video is meant to inform you, not replace a conversation with your own doctor about your specific situation. If this helped you understand your own throat symptoms a little better, subscribe, because every week I break down real published research just like this. And if you haven't seen our video on why your legs get weaker after 60, that's a great one to watch next. Let me know in the comments, which of these 4 do you think applies to you? I read every single one. This video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Please consult your doctor about persistent throat symptoms, especially before changing any medication.